Yeah, can you hear me?
Yes, please.
I wanted to ask, the DG mentioned earlier about equitable distribution of therapeutics and vaccines. I wanted to ask about Gilead's remdesivir, which received emergency use authorization in the U.S. this past week. The U.S. government is controlling the supply of remdesivir at the time. I'm wondering if the WHO would like to comment specifically on that drug.
Just to say we are grateful that the company Gilead and the Director General had direct discussions at the highest level to ensure that we had access to the remdesivir drug in order to launch the Solidarity trials around the world. And just to remind everyone that remdesivir is one of the arms of those trials. We welcome the recent data from the randomized control trials the randomized control trial that has been done in the United States, and there's signals of hope there for the potential use of the drug. And we will be engaging in discussions with Gilead and the US government as to how this drug may be made more widely available as further data emerges on its effectiveness. But we are grateful for the fact that the drug is within the Solidarity trials, and that drug was provided by the company for that purpose. Thank you.
Thank you very much. We have time for maybe 2 more questions. So let's try AFP and Nina Larsen. Nina? Can we hear Nina? If you can unmute yourself, please.
Hello, can you hear me?
Yes, now it's okay.
Okay, thank you. Thanks for taking my question. So I had a question about President Trump and his Secretary of State, Mike Pompeo, have said that they've seen enormous evidence that the novel coronavirus originated in a lab in Wuhan. I'm just wondering if the U.S. has discussed or shared this evidence with the WHO, and if the WHO is looking to investigate these claims if or when you're invited to China to participate in investigations into the origin of the outbreak. Thanks.
So I can start, and perhaps Mike would like to supplement. So let me start with the public health importance of really understanding where this SARS-CoV-2 virus, the virus that causes COVID-19, comes from. What's really important is for us to understand the zoonotic source, what we call the animal source. This is a coronavirus, and coronaviruses circulate in bats, and so there's an ancestral link to bats, and that is something that we know based on the genetic sequences of this virus and other coronaviruses that circulate globally. So we know that bats are an ancestral link. What we really need to understand is the intermediate host, the animal that was infected by bats and that infected people in some of these the earliest cases. And that's a very important piece to understand from a public health perspective so that we could prevent that from happening again. We've learned this in MERS, for example, in the beginning. We didn't know the intermediate host for MERS, and there were investigations that were taking place in the Middle East, and there was a link that was made with dromedary camels. This happens for a lot of these zoonotic pathogens. And what we need to do is we need to do these investigations, these studies, to better understand what is the animal host for COVID-19. We have discussed this with our colleagues in China, and we discussed it during the mission that I took part in February. And one of the recommendations was to be able to do those investigations and do those with our colleagues at FAO and OIE and different ministries across China. And this is an important part of our understanding of how this all began, so that we could prevent it from happening further. From all of the evidence that we have seen, from all of the sequences that are available, and there are, I believe, more than 15,000 full genome sequences available, or close to 15,000, that this virus is of natural origin. But we do need to still find the intermediate host in China, and that is something we are very supportive of to provide that support to our colleagues in China.
And just a supplement on your first question, no, we have not received any data or specific evidence from the US government relating to the purported origin of the virus. So from our perspective, this remains speculative, but like any evidence-based organization, we would be very willing to receive any information that purports to the origin of the virus, because, as Maria said, the origin of the virus is a very important piece of public health information for future control. So if that data and evidence is available, then it will be for the United States government to decide whether and when it can be shared. But it's difficult for WHO to operate in an information vacuum in that specific regard. So we focus on what we know, we focus on the evidence we have, and the evidence we have from the sequencing and from all that we have been advised is the virus itself is of natural origin, and we need to understand more about that natural origin, and particularly about intermediate hosts. This issue was one of the recommendations of the Emergency Committee on 30th of January. It was subsequently repeated in the advice the other day. The Director General, when he visited China when I was there with him, raised the issue at the highest level. Not as a specific issue, but we've been saying this since the beginning. We have to control this outbreak, and this is the most important thing we have to do. But we have to also understand the origin so that we can put in place the right public health and animal-human interface policies that will prevent this happening again. This is not unique. We have done the same in the Middle East with MERS. We have done the same with Ebola in Africa. Understanding the host animal, understanding the intermediate species, and understanding how to protect human beings in that cycle is exceptionally important. Whether that requires changes in our engagement with the natural environment, whether it requires changes in animal husbandry, when it requires changes along the food chain, we won't know exactly how that is to be managed unless we understand the animal host and the animal intermediate species. And that's an exceptionally important piece of information. Right now we have to deal with the pandemic and we've got to get it under control, but that does not lessen the importance of doing that other work. We have offered, as we do in every case with every country, assistance with carrying out those investigations, and I'm sure our colleagues in OIE and FAO are equally keen to offer that support. But again, a bit like the mission in February, we need to understand that we can learn from Chinese scientists, we can learn from each other, we can exchange knowledge, and we can find the answers together. If this is projected as aggressive investigation of wrongdoing, then I believe that's much more difficult to deal with. That's a political issue. That is not a science issue. We see scientists in China communicating, collaborating around the world right the way through this pandemic. We would like to see that spirit continue, and we would like to see scientists at the centre of the exploration of the source of this. Science needs to be at the centre. Science will find the answers. The implications of those answers can be dealt with from a policy and political perspective. So if we have a science-based investigation and a science-based inquiry as to what the origin species and the intermediate species are, then that will benefit everybody on the planet. And we believe that can be achieved with the appropriate approach to that very important question.
Thank you very much. Let's maybe try to take one more question before we conclude this press briefing. It's Simon Ateba from Today News Africa. Simon, can you hear us? Hello, do we have Simon?
Yeah.
Yes, we can hear you.
Okay. Can you hear me?
Yes.
Okay. My name is Simon Ateba from Today News Africa in Washington, D.C. WHO Africa released a statement not long ago about that WHO welcomes traditional medicine. I wanted Dr. Tedros to expand on that, what they mean by traditional medicine. Do we mean black magic, or what do they mean? And I also wanted WHO to react to the controversial bill being introduced in Nigeria, the infectious disease bill. Are you concerned that some government may use the coronavirus to turn their country into a police state? Thank you.
What WHO, and I think our African Regional Office released a statement on this, does support the use, as we do all over the world, of there's a difference here between what are natural remedies or natural supplements where people take things to feel better, and if people want to take a honey and lemon drink in order to ward off infectious diseases, that's a very different thing